Hi, I am Barkwin Michelle Delma, and welcome to my treatment evaluation presentation of Psych 645. Um, the disorder that I chose to discuss today is panic disorder. Panic disorder, also called panic attack, is defined as an episode of intense fear or discomfort that is typically accompanied by certain physical or cognitive symptoms. Symptoms can be triggered by a specific event or can even occur unexpectedly. So the criteria for panic disorder must be associated with longer than 1 month of persistent worry about one, having another attack or consequences of an attack, or significant maladaptive behavioral changes related to the attack. So the frontline treatment for panic disorder is a cognitive behavioral therapy. Cognitive behavioral therapy is based on a principle that one's thoughts cause one's feelings. Um, it is a useful strategy for panic disorder patients to manage symptoms associated with inaccurate cognitive interpretation of situations resulting from the patient's cognitive vulnerability. One of the principles in cognitive behavioral therapy is the cognitive theory. The cognitive model describes how people's perceptions of or spontaneous thoughts about situations influence their emotional, behavioral, and often psychological reactions. In panic disorder, sensitivity to bodily sensation increases due to the patient's cognitive vulnerability. Cognitive behavioral therapy can help decrease sensitivity to bodily sensation by correcting these cognitive distortions, by controlling negative thoughts and panic attacks. Patients with panic disorders learn how to effectively cope with the symptoms in cognitive behavioral therapy. One of the therapeutic techniques used in cognitive behavioral therapy is cognitive restructuring. It has to do with the identification and modification of negative thoughts that elicit and prolong anxiety. So another technique used is exposure to the stressing event or situation that causes the intense fear of or that causes the intense fear and anxiety. So the exposure to the intense fear and anxiety often results in the habituation of that stressor. So when it comes to the effectiveness of cognitive behavioral therapy, cognitive therapy it has been proven to be effective for both long and short and long-term improvement. In a study consisted of 76 panic disorder patients, um, patients in a therapy condition attended sessions once a week for a total of 12 weeks in addition to drug treatment. Post-treatment results revealed that 60% of participants were panic-free after 12 weeks of session. Okay, another treatment approach used to treat panic disorder is the psychodynamic therapy. Psychodynamic therapy is useful in the treatment of panic disorder. Broadly speaking, psychodynamic therapy is distinguished from cognitive behavioral therapy on a basis of different theoretical assumptions about the psychological processes underlying anxiety disorders, which result in different approaches to treatment. Um, so one of the theoretical principles is the psychodynamic theory. In psychodynamic theory, anxiety symptoms are often assumed to originate from relationship experience in which certain feelings or wishes were experienced by the patient as painful, dangerous, or unacceptable. So the patients learn to disavow the intense negative feelings and desires, avoid the experiences, and develop anxiety symptoms um, when triggered by sensations of loss and anger. So in that case, psychodynamic therapist encourages the patient to discuss the context in which the symptoms arise in order to understand the experiences surrounding the occurrence of symptoms. Therapists help the patient make connections between the experience of occurring symptoms and the prior interpersonal and intrapsychic event from which this anxiety produces defenses and dynamic may have originated. So one of the technique used is the panic-focused psychodynamic therapy. So what distinguishes psychodynamic therapy from other types of therapy include a focus on recognizing, acknowledging, understanding, expressing, and overcoming negative and contradictory feelings and repressed emotions in order to improve the patient's interpersonal experiences and relationships. In a study conducted by Keefe et al., psychodynamic therapy was found to be significantly more effective than control conditions. Psychodynamic therapy is effective at treating anxiety disorders, especially panic disorder, as overactive treatment and more effective than control groups. So the third and final intervention used is pharmacotherapy. So many effective treatments combine psychological and pharmacological techniques for panic attack. One half of patients with panic disorder who attend psychological clinics are already taking medication as well. Many more patients receive medication than cognitive behavioral therapy for panic disorder, mainly because primary care physicians are usually the first in line of treatment. However, combination of medication and other psychological treatment is only appropriate and effective for patients with more severe symptoms as well as complex cases that involves comorbidity. Study revealed that there is an improvement when treatment is associated with pharmacotherapy. However, even though pharmacotherapy is proven to be effective, cognitive behavioral therapies continue to play a central role in providing the most effective treatment strategies for helping patients with panic disorder. One of the biblical-based intervention that can be used to treat panic disorder is prayer. Prayer fosters calm, control, and support. It lowers stress, which positively impacts many aspects of our physical health. In my own experience, Philippians 4:6-7 states, "Do not be anxious about anything, but with everything, by prayer and petition with thanksgiving, present your request to God, and the peace of God, which transcends all understanding, will guard your heart and your mind in Christ Jesus." Here is my resources, and thank you very much.